Hello friends, welcome back to my channel. Today I'm going to share some information on hyperlipidemia or high cholesterol among children. After watching my last YouTube video, one of my YouTube channel subscribers contacted me concerning her 10-year-old child with high cholesterol. I'm definitely motivated to share the same information what I shared with her, which would benefit many. There are various causes for high cholesterol levels. This includes dietary causes, secondary causes such as obesity, diabetes, nephrotic syndrome, and so on, and genetic causes. When you have a family member with history of coronary artery disease or stroke, heart attack, or death related to cardiovascular event at earlier age, can put you at risk. It increases your risk by double. Worldwide, South Asians have the highest risk of cardiovascular events or coronary artery disease. Average incident age of coronary artery disease in India is 52 as compared to early 70s in white Americans. Atherosclerosis or deposition of fatty materials on the inner walls of the blood vessels such as arteries does not happen overnight. This process starts early in life. Unfortunately, in the United States, 20% of children between age 6 and 19 have one or more high lipid value, whereas it is highly common among Indian children. If your child presents with any one or more risk factors you see it on the screen, lipid or cholesterol checks should begin at age 2. As long as the risk factors continue, check their lipid panel every 1 to 3 years. If your child does not have any of the risk factors, get their cholesterol levels checked between age 9 and 11 and repeat at age between 17 and 21. Lipid screening is not recommended between age 12 and 16 as the lipids vary during puberty. Some information on the lipid screening results. You see two different cholesterols on the screen. One is non-HDL, the second one is LDL. Non-HDL is the subtraction of HDL, which is good cholesterol, from the total cholesterol. Non-HDL itself a risk factor. LDL is a low-density lipoprotein, and that's the bad cholesterol. So the numbers on the screen reflects whether your numbers are at acceptable range, borderline, or high. So what are the recommendations? And if you are at borderline, we can manage your cholesterol by dietary and other lifestyle modifications. And if your cholesterol level is at high range, that is LDL above 130, along with dietary and lifestyle modifications, we can consider pharmacological interventions, that is starting the child on medication. This should happen after 10 years of age. We do not want to start any medication below 10 years. And if your cholesterol level is above 250, get evaluated by a pediatric lipid specialist. Genetic screening may be warranted. Coming to the diet and lifestyle, it is recommended that you increase your fiber in your diet, that is vegetables, fruits, and whole grains. Reduce saturated fatty acids and trans fats. Increase activity. Children should be engaged in at least 60 minutes of moderate to vigorous activities daily. This includes walking, hiking, biking, or any kind of sports, games, dancing, and so on. Limit screen timing to less than 2 hours a day. Weight loss in children with obesity, and avoidance of nicotine exposure. Children are our future. Early identification and control will reduce the risk and severity of cardiovascular disease, including early cardiovascular deaths in adulthood. Thank you for your attention. Feel free to add your comments. If you like the information, please share and subscribe. Thank you.